It's a good question. There's lots of things on the horizon, and cardiology is a very exciting area because there's always lots of new treatments. I think there's two general themes to the new treatments that are going to be available increasingly in the future. One of them is early recognition and prevention of heart problems. So instead of waiting till people develop serious heart problems and needing things to be done, then I think we'll probably get better at identifying the earlier stages of diseases and being able to do something about that. And there are newer ways of detecting very early changes in the arteries to the heart, for example, using CT scanning technology, and these are things that we increasingly use now. There are ways of assessing whether the patient's heart is under strain when they exercise, and there are ways of assessing the function and the valves of the heart. So we're very keen on identifying problems with the heart very early on, and in many cases you can then prevent problems. In the patients who do present with heart problems that need something to be done, the aim now is generally to try and see if it's possible to do the procedure in as least invasive way as possible. So for example, in many elderly patients who may not be suitable for general anaesthesia, to see if they can be done under local anaesthetics, and to see if procedures can be done through smaller and smaller incisions and wounds if we can possibly do this. And once again, this is something where as groups of doctors we often collaborate on this. So cardiologists may work with surgeons who have particular interest in doing procedures through what we call keyhole access procedures, and it's very important to be able to discuss these with the patient to recognise the pros and cons. But the two things in general, one of them is recognising things early and being able to deal with things in as least invasive way as possible, and this is something that Keyhole Clinic is pioneering.